You're tuning into the Active Mom Podcast with physical therapist, Dr. Carrie Pagliano, a real mom's guide to all things postpartum return to workouts after baby. If you're a postpartum mom, coach, trainer, or physical therapist looking for answers on how to get back to running, CrossFit, yoga, Pilates, HIIT, you name it, without the fear of pelvic floor issues or doing something wrong, this is the podcast for you. Let's start the show.
All right. Admittedly, I am not a cyclist. I have been known to get on a bike, but it's not something I enjoy. And part of it is because it hurts my bottom. And so I did a little Google stalking because it's hard to find experts in bike fitting and physios that work with bikers and actually can speak pelvic floor language. And so this is the result of my Google stalking. We have Dr. Chloë Murdock. She is a physical therapist in Ventura, California, and she works with a lot of endurance athletes and cyclists, and she's going to demystify everything about the bike. So thanks for being on the Active Mom Postpartum podcast, Chloë.
Thank you for having me. I'm happy to talk about bikes anytime.
Awesome. And you have biked a long time, right?
I have, yeah. I grew up cycling, and I've been in that world in different ways for some time. So it's definitely a personal interest that I come to the field with. But professionally, I also work with a lot of, like you said, endurance athletes, cyclists, triathletes, and I'm a bike fitter as well. So I'm kind of surrounded by by cyclists quite a bit.
I can't wait to pick your brain on that. I think the thing that struck me when I heard about you, I think I was kind of diving through the archives on Feisty Menopause's podcast, and you were on in 2020, and you were talking about pelvic floor, and it's really hard to find not only physios that do a good job kind of talking about bike fitting, but like that will actually utter the word pelvic floor. So let's just kind of start with the basics. Like, why does the pelvic floor, why does the pelvis even matter for cycling?
Well, I mean, the pelvic floor and the pelvis matters in any sport. And so that's I think the simple answer. The unique demands, I mean, cycling is unique compared to most other sports, compared to running, for example, because of the contact points between the cyclist and the bike. And so the pelvis is one of the primary weight-bearing structures when one is cycling, assuming one is sitting when they're cycling. Mountain biking is a little bit different because it's a bit more dynamic and the rider is up and out of the saddle more often. But there's a lot of direct pressure placed directly on the pelvis. And so that affects the entire body. It affects the mechanics of all of the musculature around the pelvis and the hips and the spine. And it places unique demands on the pelvic floor because there's actually direct pressure on the pelvis and sometimes on the pelvic floor in a way that can cause issues.
And it's not comfy. My daughter's 9, and she's I obviously she needs to get a better seat, but she's like, "Mama, this hurts." So, yeah. So talk to me about that. Like, and my mom, actually, she broke her ankle. She's 75 and she broke her ankle over the winter mountain biking. So she has like found a seat that works for her and comfy. Like, what is it that's different? Like, why do women need kind of these different options for seating and setup and all of that?
Well, I think we should take a step back because I think there is an unrealistic expectation about how comfortable any bike saddle should be.
Okay.
And similar to any sport, there's a certain amount of inherent discomfort in doing any endurance sport because you're doing a repetitive movement for a very long time.
Right.
And so cycling specific, you're sitting on a surface, on a saddle that is shaped differently than likely anything else you're ever putting pressure on. And so there's a certain amount of, I think, mild like pressure discomfort that should be expected when we're sitting on a saddle. But that can really, there is a variety of symptoms that someone might feel. And I certainly don't want someone to be in so much discomfort that they're having lasting negative effects from cycling, or that they have to modify their riding because of it. That it's so uncomfortable that they can't finish a ride or ride to the extent they want to.
Yeah.
And the other factor there is that, the ability to more or less comfortably apply pressure or sit on a saddle depends on how much you do it. And so if someone is riding a bike, like your daughter, for example, maybe she's riding a bike, I don't know, once a week, a couple times a week. I mean, for someone of that age, I would expect that we could find a pretty easy solution, maybe just a different shape of the saddle.
I think probably.
But for adults, I think there's an unrealistic expectation that, with our work schedules, we can be weekend warriors and go out on the weekend and just hammer out a 4-hour ride, and that should be comfortable. But if you think about it, I mean, I think that assumption is wrong, because you're only spending one day per week in that specific position. And it's not just the pressure on the saddle, but in the specific position that, for example, a road bike demands. And so bent forward for 4 hours with the neck extended and the pelvis rotated forward, and then pressure directly sometimes on the sit bones, well, definitely on the sit bones, on the soft tissue in between, on the perineum.
Yeah.
So it takes some time to build up tolerance to place pressure there more or less comfortably.
So what you're saying is, when I go out for a bike ride once every 3 months and it's sore on my sit bones, then I should probably do it a little bit more to get used to it.
Yeah, that's a good starting spot.
And that's even with bike shorts too.
Yeah.
So I've seen some that have little cutouts, almost like where the perineum is. Is that a good thing? Is that something people should be looking for if they're having compression there?
Yeah, it can be. I mean, bike seats are similar to running shoes in that someone really needs to actually sit on the saddle in the position you're riding in to get the most amount of feedback. And so a lot of different fit parameters or ways to describe a saddle: the shape of the saddle, the length, the width of the rear of the saddle, the width of the nose, the fact that if there's a cutout in the nose or not, like you mentioned, the padding, the density of the padding. And so there are a lot of factors that go into, there are a lot of components of a bike saddle.
Mm-hmm.
And the position of the rider overall on the bike has a big impact on that as well. Okay. And so to come back to your question about cutout, yes, cutout can be useful for a lot of people because it alleviates pressure on some very sensitive tissue, especially for women, because women are placing pressure on different anatomical structures than men, on much more sensitive structures, I would argue.
Yes.
And if there's a cutout in the nose of the saddle, that alleviates pressure on some of that sensitive tissue, but it also reduces the surface area that one can spread the pressure over. And so if the nose of the saddle, for example, is quite narrow and there's a cutout, that means the surface area is quite small. And that might result in the peak pressures on the area where there is contact being too high.
I never actually thought about that. That makes a lot of sense though. When you to take a step back, when you talk about what should feel normal, normal discomfort, and what is abnormal, let's say I start riding once or twice a week, and get a little bit more regular, what's normal feeling down there? What should I be feeling, and what's bad? I probably need to go get my bike checked.
Yeah. Well, it's normal to feel pressure, and it's normal to feel, it's not unusual to feel mild numbness if you've been sitting in one position without standing up out of the saddle, 15, 20, 30 minutes. If you can stand up out of the saddle and within 10 seconds, that potential numbness goes away and it stays away for another 15, 20 minutes, I would argue that that's acceptable amount of discomfort.
Gotcha.
If someone is having saddle sores, and that can be a result of chafing, it's usually a result of chafing. Anything that breaks the skin. So if you shower afterwards and you feel any burning, that's a good indication that the skin has been broken.
Yes.
Fine. If anyone's having numbness that persists after they get off the bike, that's not a good sign. If someone is feeling any change, if someone has a history of, for example, urinary symptoms or urinary dysfunction.
Right.
I'm talking about females specifically here. If a woman is experiencing an increase in urinary incontinence afterwards or urinary retention, those are not good signs either.
Gotcha. And as far as the chafing goes, is it like similar with running where you can just throw some Body Glide on there and you're kind of good? Because I've seen these others like nut butters and things like, I'm like, I don't know what this stuff is.
So what you're talking about is chamois cream, and it's essentially the same thing. So it creates a barrier between the skin and the clothing, the cycling shorts usually.
Gotcha.
And yeah, it can be as simple as doing that. So well-fitting shorts are really important. In cycling, you don't want folds in the fabric. Well, I should take a step back. Cycling shorts are designed to be worn without underwear. And so, yeah,
I did not know this.
A lot of people don't know that. And that is a key point. That'll change your life in and of itself.
I think you really did just alter my life right then. So, why is it you go to the store and they don't just say that? Like,
that's a great question. I don't have a good answer for that.
I'm 47 years old. This is the first time I've ever heard this.
Yeah.
Okay, so unpack this. You're going commando.
Yep.
How do you go to the store and be like, I need bike shorts and I need to make sure that it fits? Because typically too, you're supposed to try this stuff on with underwear, right? So
yes.
Okay.
So try them on with underwear, but you want them to be snug fitting. And then the reason you don't want to wear underwear with is because you don't want there to be any bunching, folding,
gotcha.
Chafing between your underwear and the short. You want the shorts to fit to your skin very snugly.
Okay.
And good quality shorts should follow the contour of your body when you're in a flex forward position. So imagine your pelvis is rotated forward, you're bent forward to reach over to the handlebar. The contour of the shorts or the pants should follow that shape. And so when you stand upright, they should be quite snug in the front because they're designed to be worn bent forward.
Okay, because I've always felt like when I stand up, I have like a big saggy full diaper in the back. So that's actually kind of normal, right?
Yeah, you don't want it to be too saggy because when you bend forward, you want all that.
It would tighten.
Yeah, you want all to be snug. And so when you're sitting on a bike seat, and that's why it's useful to sit on a bike saddle when you're trying bike shorts. If that's not possible, you can sit on a chair and just bend forward and look down, and you don't want any bunching in the front, bunching around the folds between where the upper legs meet the pelvis.
Okay. What are the biggest differences like between women's bike shorts? Are there like, other than just like brand differences, like what kinds of options do we have?
Yeah, that's a good question. I mean, for some women, men's shorts fit just fine. And so the distribution of padding should be different between men's and women's shorts. I haven't done a deep dive into the actual construction differences, but in the cheaper shorts, and good quality shorts can be quite expensive. Cheaper shorts, there's probably not much of a difference.
Okay.
But the shape of a female pelvis is different than a male. We have wider bones. And when we're sitting on a saddle, most women are putting more pressure on the nose of the saddle than the arm. And so there should be more padding under that area. So under the pubic bones in the front.
Okay.
And in general, for men and women, bib shorts are definitely very, very useful. And so bib shorts are the ones that have the suspenders built in. And the reason those are so nice and comfortable is that they prevent a lot of bunching and chafing around the waist when you bend forward. And so they keep that, and they help to keep the pad of the short flush against the pelvis.
Okay.
So that they're not riding down the routine.
Okay. So that actually leads really nicely into my next question, and forgive my ignorance here. Like if you're doing triathlons, don't you wear the same shorts biking as you do running?
Yes.
Okay. So now you got to unpack the whole diaper action. Like obviously that would be set up differently, right? So you're not running like you have a diaper?
Yeah, that's correct. So triathlon shorts are different than other cycling shorts.
Okay.
In that the padding is much thinner. They're designed to do all three disciplines. So they're designed to be, to go in the water, of course, and then to run it afterwards. That being said, and so triathlon shorts they're not going to be as comfortable for most people.
Okay.
And so there's nothing wrong with wearing, for example, road cycling shorts in all of your training and then doing your, your brick workouts, and then of course racing in the triathlon shorts.
But I should expect that I would be more uncomfortable during the race itself because I don't have as much cushion.
Yes, I mean, there should be, in any kind of race prep, you should prepare in the gear that you're going to wear. And so you should do some training in the triathlon shorts you're going to be racing in.
I gotcha.
Just to test them.
Okay.
Make sure that they're adequate. But yes, I mean, they have much less padding, and the position that a triathlete is in and where the padding is quite different than like road cycling or mountain biking as well.
Gotcha. Okay. Sorry for going down the wardrobe like rabbit hole, but I was like, I did not know any of this stuff. And that's one of the reasons, honestly, like I mean, I swam growing up. I'm a runner. Like one of the reasons I have no desire to do triathlon is because of the cycling and the discomfort part. And I was like, wait, there's another way. Okay, that's good to know. All right, so we'll come back off the rails here to come back to pelvic stuff. So I think like a couple of the primary issues that I run into with clients are, one is the discomfort on the bike seat. The other is kind of shifting gears to kind of pregnancy, postpartum. And a lot of it tends to be, a little bit more Peloton-esque, if that makes sense. I just told you I saw a post by Jen Gunter this morning. She was calling it Peloton perineum. And like, how do you get, like most women aren't going to necessarily go off and start immediately postpartum on a road bike or something like that. And people have access to, Peloton and whatnot. Like, what's a good place to start as far as you haven't been cycling? You want to start to get back a little bit, but, you're worried about pelvic floor issues, leakage, prolapse, that kind of stuff. The recommendations I tend to give are just start almost like running, where you're like, let's just do a little bit really easy, flat stuff. And then the more challenging would be changing resistance and then also getting up off the saddle. But other than that, like what other considerations kind of do we have as far as, getting back?
Well, I think cycling it can be a great way to reintroduce more exercise postpartum. I mean, the biggest limitation to that is that you're sitting directly on the pelvis. And so
right.
That is not, for most women, that's not going to sound very appealing.
Yeah.
But if you consider common pelvic floor dysfunctions postpartum, so urinary stress incontinence, for example, there's obviously much less impact cycling than running.
Right.
And so someone might be able to introduce more volume on the bike, assuming that they can comfortably put pressure on the saddle earlier than they could running. That would be a slower buildup. And so the physiological considerations, the things that as physical therapists we would consider getting someone back to cycling would be quite similar. We want them able to, expand the rib cage and meet certain markers. Because of the flex forward position, if we talk about road cycling, any kind of cycling really, there's going to be a forward flexion. And so gravity will be resisting the trunk in a different way. And so if you equate it to more of a quadruped position, the gravity is resisting the anterior core more directly. And so making sure that someone has adequate transverse abdominis control and the ability to also expand the posterior rib cage in that position.
Yep.
Quite useful. And then if we're considering someone who has been cycling before, maybe someone who cycled before pregnancy or maybe even into pregnancy, if someone already has their own bike, then putting their own bike on a stationary trainer is probably the best option because the bike is already assumedly fit for them well.
Right.
Of course, having a bike fit check postpartum, I think, is very useful because anatomy changes and maybe putting pressure on is no longer comfortable. And so making sure that the saddle is supporting the bones of the pelvis well and all the pressure is not just going into soft tissue is going to be really important. Right. And a lot of bike fitters are able, I'm sure they're in most urban areas, in most metro areas, you will be able to find a bike fitter that might come to your house and actually help set up.
Cool.
Or people like myself who do remote consultations who might be able to get someone close enough. and remotely talk through different components of getting comfortable on the bike. But yeah, in terms of transitioning back into the sport itself, starting conservatively, and the biggest limitation there is going to be just the time spent sitting on the pelvis on the bike saddle.
Gotcha. Now, I know nothing about Peloton bikes, and you may or may not. Like, can you change the seat on a Peloton bike?
Uh-huh.
Okay,
Yeah.
that's great to know. Because I have had a lot of women that in pregnancy, like that's an easy thing to do, especially if they have other kids. And that's the most obvious one, I think, at first, where you really do need to change that position because the belly is kind of in the way. What are some of the typical kind of modifications that a mom might want to consider as that belly gets bigger and, they really just can't, there's no place for it to go anymore?
Yeah. Well, the biggest change is bringing the handlebar higher so that you can breathe. And so,
that breathing's important.
And so the handlebar is going to raise over time, and the handlebar might come closer to the rider, and so the handlebar might come up and near, up and closer to one. Other considerations are the shape of the saddle itself, and so I mentioned earlier that the best saddle for someone depends on the position they're riding in.
Gotcha.
And so as a rider comes into a more upright position, you imagine the position of the pelvis also changes. So if someone is riding a very low position in the front, then there will be more pressure on the pubic rami and the pubic bones in the front. And as one comes into a more upright position, more pressure goes onto the sit bones. And so that means that cushioning under the density of the padding under the sit bones needs to be adequate.
Gotcha.
And the most important thing there is the, in terms of the rear of the saddle, is the actual width of the saddle. And so the width of the saddle has to be wide enough to capture and support the ischial tuberosities. Because if it's too narrow, the pressure goes in between on soft tissue. And that has a tendency to cause riders to grip, either partially the grip with the glutes or the pelvic floor, the posterior pelvic floor in particular.
Yeah.
And that can cause the same issues that gripping the pelvic floor in any other situation can cause.
Yeah. And that kind of alludes a little bit to, I used to do a lot more with pelvic pain and having patients that had like pudendal neuralgia or overactivity in the pelvic floor related to their cycling and things like that. And it's funny because I do think, and we talked about this a little bit before we came on, about just more women are in endurance sports and showing up and performing in postpartum a lot more. And just, I feel like the more examples we have, just seeing the prevalence of overactivity in the pelvic floor in these endurance kind of sports, running, cycling, swimming, that kind of stuff as well. Is that something that you're kind of seeing a little bit more because you have a little bit of that kind of pelvic floor background and knowledge, plus the ortho, plus the bike fit background?
I see it a lot, but it's hard to say if that's because that's the population I focus on, or if that's because there's a true increase in women in endurance sports. I mean, obviously there's a huge gradual, there's an overall gradual increase in female participation in endurance sports. And I do see it commonly. If we talk about cycling in particular, more women, it's the fastest growing segment of the cycling industry is women coming into the sport. And
yeah, so I believe it.
So that's a great thing. And I do think there's a great need for knowledge there.
Yes. Well, I think sorry, I didn't mean to interrupt you there. Go ahead and finish. Okay. No, I mean, I've been, pelvic floor back in the day, anything postpartum, pregnancy related, it was always underactivity of the pelvic floor. Oh, you had a kid, or, oh, you're pregnant, and it must be that. And now we're just understanding stress urinary incontinence, absolutely overactivity in the pelvic floor, even pelvic organ prolapse, there can be some prevalence there. But I think we're much more accepting of the fact that these issues can be overactivity in the pelvic floor. And my population is a lot of, runners, CrossFit athletes, that sort of thing too, getting more into triathlon and ultras and that sort of thing. And just the prevalence is there. But I think we're just finally talking about it. There's more women doing it. There's more women talking about it. We're finally getting our hands on them sooner I think this whole myth of underactivity of the pelvic floor just because we're women is kind of crap, but
Yeah, I see it quite a bit for sure.
yeah.
And coming back to the influence of the saddle on it, when the saddle is slightly too narrow for one's sit bones, and we know that the width of the ischial tuberosities in a female pelvis is, it's much wider than a male.
Right.
If the saddle is not wide enough to capture those sit bones, then there's going to be direct pressure between the lateral, the outer edges of the saddle, and the medial edges of the ischial tuberosities, and that's going to potentially compress on the Elcock's canal, so where the pudendal nerve travels.
Yep.
That's an issue I see in men and women quite a bit.
Yep. Yeah. No, that's definitely. I that back in the day, anytime you would hear pudendal neuralgia, the first question is, do you cycle? Do you do this? Do you feel like you're sitting on a golf ball? Like that kind of stuff. I feel like that's been sort of accepted for a while that like, okay, if you're sitting on something, it might hurt. There's overactivity involved. I think it's just getting a little bit more nuanced now because, we do have these postpartum conversations and the bias was very much like, oh no, they can't have overactivity in the pelvic floor. They're postpartum. Like, actually we can.
Yeah, I see it.
What are kind of the most common like pelvic, hip, pelvic floor diagnoses that you do see that are pretty common with your endurance athletes?
Pain.
Yeah.
Pain. Yeah. And often I will capture these patients or just kind of come to that conclusion after going through a bike fit with them. Asymmetrical, so someone sitting asymmetrically on the saddle can be a clue that there's something going on with the dynamics of the lumbo-pelvic hip complex.
Yep.
That might be an asymmetry in strength. It might be an asymmetry in mobility, stability, endurance.
Yep.
And so I do see, like you mentioned, I do see a lot of hypertonicity of the pelvic floor. I have some athletes with urinary retention after cycling. I have often they'll come in with more obtuse complaints like ischial tuberosity pain, what they would consider high hamstring pain, chronic high hamstring pain.
Mm-hmm.
But a lot of it does come back to, I would say, hypertonicity or tightness, or the inability to lengthen and relax the pelvic floor when it needs to relax.
Yep.
And imbalance between that and deficiencies or weak links elsewhere.
Yeah, it's always and I think that's one of the beautiful things about somebody like you that has an appreciation, understanding of pelvic floor plus all this other stuff, is you understand that it's all connected. And I'm so glad that there's kind of been this huge shift. Like back in the day when I started 25 years ago, there was just not, we were in completely different kind of rooms. But I think it's something that is just more commonly accepted now. But with a bike fit, you talk about a bike fit. What does that typically look like for, let's say I was like, okay, I'm going to go get a bike fit. What would that look like?
So a bike fit is essentially a process that we should go through together to figure out your optimal position at this point in time on the bike. And so that needs to be catered toward the type of cycling that you're doing and what your goals with cycling are. And so if you're specific, if you are a road cyclist and you're riding your bike twice a week and your goal is to improve your comfort, then we would go through an off the bike quick assessment to look at some key components like hip mobility, hamstring length, very basic, I would say like an active movement screen. Mm-hmm. That can identify deficiencies or asymmetries in stability or big mobility deficits that I need to be aware of as we're going through the process.
Yep.
Assuming you're coming into the bike fit and you've done some riding before, you're not completely new to the sport, then I would watch you ride your bike. That gives me a lot of information, of course, to see where you're coming from. Like what position have you grown used to? What is problematic about that position? And that's the best case scenario, that someone comes in and they have maybe specific complaints. And so they say, I want to be comfortable on the bike, and these are the things that aren't comfortable right now.
Gotcha.
or I want to improve my performance and I have a specific, time goal for a race in 6 months. And then the process might look a little bit different because we might focus on different parameters and measure different things during the BikeFit.
Now, is it like video involvement with that? Like, are you kind of analyzing video and looking back and sharing with them, or how does that work?
It can be, yeah, it can be. If someone is a recreational cyclist and riding twice a week and their goal is comfort, we would go through a full fit on what's called a sizing bike or a fitting bike. And so I might start in a position that's fairly similar to what they're used to. And we have the ability with these sizing bikes or fit bikes to change the position of every contact point on the bike. And so we can change saddle height very quickly. So someone can compare in real time, I'm riding here and now, I'm riding with the saddle 5 millimeters lower.
Okay.
What effect does that have on my ability to keep the pelvis still on the saddle? Like, am I rocking less, for example? Or is the pressure less in that spot that's uncomfortable? And so we have a lot of, I personally have a lot of technology available. We have pressure maps. We can measure pressure on the saddle, pressure of the feet in the
that's cool.
We do have 3D motion analysis as well. We have a fitting bike. So we have all kinds of things, a lot of parameters we can measure, but it's not necessary to measure all of those with every fit. We need to really identify what's the goal of that.
Gotcha.
So a good bike fit would involve a dynamic process where the cyclist is trying a variety of positions and having to offer specific feedback on that. And depending on one's ability to offer feedback, I might use other technology to confirm what they're saying. Most people have the ability to kind of articulate what they're feeling. Some people won't. And if they don't, then we need to kind of take the horns and maybe guide them, that person more. But it really should be a dynamic process where the rider is trying a variety of bike saddles and cleat positions. We adjust the cleats in the shoes. We might adjust the insoles in the shoes. We might adjust the shoes themselves. And so someone can try a variety of positions and actually give feedback about what feels different. I can watch how their mechanics change in a variety of positions. And then we together decide on the optimal position given what their goals are. And we record that full position. And so we can measure it by hand, or we have a retool machine where I work. And so we can use computerized technology to measure the check points. And then we have that diagram, we have that fit, those fit specs that we keep. And then we can use that to either retrofit their existing bike to that exact position or to help someone buy a new bike if that's what their goal is.
Gotcha. So that sounds like the super, like the Cadillac. How would that translate to like a virtual assessment?
Well, a virtual assessment is much more limited because we can't adjust any of those things. And so I offer remote services, for example, and in part of my as part of my consultations, I will analyze someone's position. So I'll have someone send me video of them riding their bike on a stationary trainer from different angles, and so from the side, from the front, from the back, and I can offer, based on their feedback and complaints, I can offer general advice. And based on their symptoms, usually these are people who have had a bike fit before with ongoing issues. I can talk about, we can go through the changes they have made, discuss what has helped and what hasn't helped, and I can point them in the right direction.
Gotcha. Okay, so that makes sense.
And so if this is someone having a virtual, let's say, bike fit on a peloton, I mean, let's assume that person has never had a bike fit before. And so I can at least help someone get in the range of correct position, like close to somewhere within that normative range. And then I can say, these are the bike shops you could check out where you can actually sit on different saddles in a position that mimics this. And then you can kind of tie in the last pieces.
Gotcha. Yeah, that's really similar to kind of how I do a lot of virtual stuff, is like you do a lot from video analysis and say, okay, here's where I think we could make some changes. But it does help to have kind of resources on the ground where they are. And you mentioned that you said that the BikeFit organization that you're a part of, they're starting to build kind of a locator. Like, can you share a little bit more about that?
Yeah. So the International Bike Fitting Institute is a nonprofit organization that is aimed at with the goal of standardizing bike fit education and
Okay. I'm gonna pop
also
that up here.
IBFI,
Okay.
and also providing consumers with a database where they can locate bike fitters through their map.
That's awesome.
And so if you go on the map, you can search in different locations, and you can see the bike fitters' credentials and what kind of training they've gone through.
Mm-hmm.
There are a lot of different bike fitting education tracks out there, and the goal of this is to try and present a more, I think, clean and understandable way for consumers to say, oh, this person is a bike fitter, but what does that really mean? You know, like this person's a nutritionist, but that could mean a lot of things. This person's a personal trainer.
Right.
What is their real experience? You know, like how many clients have they worked with? What technology did they use? How much training have they gone through? You know, have they done research? You know, these kinds of things.
Now, in your training, and I think I probably know the answer, is there any specific kind of addressing of somebody like a pregnant athlete, or is that just kind of put underneath the umbrella of somebody that might be obese or something like that?
Bike fitting you're talking about?
Yeah.
No.
Yeah. I'm like, I know the answer to this before I ask it.
No.
But that's, you know, I was really excited to kind of come across kind of your information, because again, like, I think it's kind of like everything in pregnancy, postpartum, is it's easy to find really general stuff, but it's hard to find these little kind of niches and nuances. And women are so much more active now in pregnancy and postpartum, and more women are cycling. It's like, that's a question to ask, is don't necessarily assume that this person who is working with you has worked with a pregnant or postpartum athlete and understands the concerns. That's why it's nice to kind of have a team, because they don't necessarily have to know all the things, but if you have like a pelvic floor PT or an orthopedic PT that's used to working with pregnancy and postpartum and bike fitting, they can kind of do the language translation or kind of the whatever needs to occur so that the results what's intended. But it's really hard right now to be like, yeah, I know a bike fitter that works with pregnant and postpartum women, you know?
Yeah. And I mean, I think it's worth mentioning too that bike fitters come from a lot of different backgrounds.
Right.
Traditionally, bike fitters come from the cycling industry world, and so bike fitters were mechanics. Bike fitters were ex-professional or current professional, usually ex-professional racers, or cycling or triathlon coaches. And so it's only been relatively recently that physical therapists have come into this field. And being a physical therapist does not guarantee that someone's going to be a good bike fitter. They are very distinctly different industry. And I think there can be chafing and pushback from those who have been involved in the cycling industry and bike fitting for a long time, seeing a lot of physical therapists call themselves bike fitters, because there is so much to know, and it really is a different field.
Yeah.
There's a lot of overlap there should be a lot of overlap in knowledge. But like I said, being a physio doesn't guarantee that someone's
no. I mean, I think you could say that across the board. There's, you know, good physios and not so good ones. So we kind of have an idea, like, what are some common mistakes that you see, either kind of from physios working with cycling clients or kind of newbie bike fitters? What are some of the most common mistakes that you see they make and that you have to kind of go in and sort of recorrect later on?
Yeah, I wouldn't say necessarily this is a mistake, but rather an inherent shortcoming depending on the environment that is working in.
Okay.
A lot of physical therapists that are doing bike fits, they're doing bike fit work, are doing that in a clinic setting.
Mm-hmm.
And it is impossible to do a comprehensive dynamic bike fit in a clinic setting for a couple of reasons. One is that clinics are not going to be able to stock the amount of inventory necessary to allow someone to try the variety of positions that are possible.
Gotcha.
That's the biggest. It's just a logistical drawback. And so if you go into a good bike fit studio or a bike shop that caters to bike fitting, you will see a wall of handlebars, and you will see a wall of, and you will see, there are so many parts involved that, I mean, they're all not all going to be used in the context of one bike fit, but to have variety is necessary. And so you don't know what you don't know. If you haven't tried different shapes of handlebars, if you haven't tried different saddles with different density padding, different shapes, different contours, different cutouts, or etc., the rider doesn't know what they're potentially missing. And so there's just equipment involved that I think physical therapists in a setting have the ability to say, this is within the realm of acceptable or not, but they don't have the equipment to try all the options that can make the difference.
Gotcha. So asking the reverse question, do you ever see and I think there's probably lots of parallels in our field where you have people that are bike fitters that, let's say I went to a bike fitter and said, oh, well, I have, pelvic pain or something like that. And they kind of oh yeah, I totally have this, but they kind of missed the boat a little bit.
Oh, sure. Yeah. Yeah. That happens. I think coming from the other direction, if a bike fitter does not have a lot of, let's say, anatomical or physiological knowledge, or the ability to do movement screens or screen for certain intrinsic components like mobility factors, strength, stability, the assumption might be made by that bike fitter that all of those problems can be fixed through the bike fit itself.
Gotcha.
And the benefit to working with someone who recognizes what they know and what they don't know, which is a great skill to have, or a bike fitter that has knowledge of both, that person will be better able to identify how much of these complaints are being driven by the cyclist and the cyclist's body that has to be addressed off bike, and how much is being driven by the position itself, the bike fit itself.
Gotcha. No, that makes sense. And I mean, as always, best case scenario teamwork approach. But it sounds like, I mean, the average person, let's say they want to start cycling, but they have issues. An average bike store is going to be able to get you started. You don't have to start with, all these nuances and things like that. That's probably more appropriate if you're having more issues that aren't resolving, or you're trying to improve performance. Is that pretty accurate?
I actually disagree with that. If someone is new to cycling, I see a lot of cyclists, women in particular, leave the sport because it hurts, because it's uncomfortable. And so the cost of a bike fit can seem prohibitive on the front end if someone is getting into the sport.
Yep.
But if someone can start the sport comfortable, they're much more likely to stick with it.
Yep.
And the other argument I would make is that if someone is first getting into cycling, or they're becoming more serious about it, they want to do it more, that cyclist will save themselves a lot of money by getting the bike set up correctly for them initially, then buying a bike and riding it uncomfortably for a while, and then bringing it in for a bike fit and realizing that a lot of parts need to be changed. And so the best time to get a bike fit is before you bike, because then you get the bike that fits you perfectly. And good bike will help you with that.
I like that. I'm a huge fan of kind of playing the long game, and a little bit upfront will save you a lot in the long run. So it's probably the same thing with running shoes too. Like, don't start with trash. Trash in is trash out. So yeah, no, I like that approach. And then maybe Actually, my entire family probably could use a whole bike fit scenario. So I'll let you know if we if we start down that rabbit hole, how that all plays out. All right, we ask everybody some questions at the end of each episode. So for you, book you're reading or podcast you're listening to right now?
I'm listening to Maintenance Phase right now.
What is that?
You know, maintenance phase is nothing to do with bike fitting, to do with physiotherapy. It's just it's great listening.
Okay.
I'm gonna names down. Michael Hobbs and I'm forgetting the woman's name right now who's on the podcast. But essentially, they're both writers and journalists, and they do a deep dive into a lot of wellness related topics.
Ooh.
And debunk myths, and they just do more in-depth and reporting certain subjects. And so their slant is toward the wellness industry, and there's a lot of misinformation and harm that comes out of the wellness industry. So it really if it's cynical, my cynical self.
I was going to say that sounds like a perfect podcast listen for certain moods that I have.
Highly recommended.
Yeah. Like it. All right. Who is someone kind of in your arena, in women's sports, cycling, all that we should know about?
We should know about. That's a good question.
Like, who are you fangirling right now?
I mean, I'm always a fangirl of Katarina Nash. She's a cyclocross racer. She's well into her career. She comes from a cross-country skiing background. She was an Olympian in cross-country skiing.
Oh, now I need to Google her.
And she's a professional mountain biker and cyclocross racer now. And she's been Olympian. She's in winter and summer Olympics, which is quite impressive.
That's super cool.
I've seen her at a couple of races. I mean, she doesn't know who I am, but I've seen her at a couple of races, and she has had Vizslas in the past. Dogs.
Yep. Yes.
And I actually got a Vizsla myself because I was looking for a dog I could take mountain biking, and I saw her mountain biking with her. Oh, that's it. So that's an obvious answer.
Very cool. Very cool. We have, I don't know if you've ever heard of him, one of our local stars in the area is Michael Wardian. He ran across the United States last year, and he's got a couple Vizslas that he runs with. And he does ultras and all sorts of stuff. And my podcast editor, Laura, we totally fangirl. So occasionally I'll see him out running. And one day he had both his dogs, and they were just dragging him, and he's fast, like super fast. And I'm like, yeah, I think that's definitely like an endurance dog. I have a border terrier, so I don't think that would work out. But I'm going to check her out because I was a Nordic skier growing up in upstate New York. So I am a huge fangirl of finding where those skiers went. So we'll check that out for sure. Cool.
Where are you from in upstate New York?
South Rochester. Do I need to go further?
I grew up in Ithaca.
Okay. See, this is the New York State game that I love playing. So I grew up about 30 minutes from Geneseo, which people usually know because of SUNY Geneseo. Almost went to PT school in Ithaca, ended up in Philadelphia instead. Very, very different places. But I do miss, we had Nordic skiing at my high school that I graduated from. Unfortunately, like the weather's changed so much there that, it's really narrowed where they can ski now in the winter. But that's the one bummer of living here in DC is we didn't get any snow last year, and it just makes me really, really sad. So, yeah. All right. But New Yorkers are awesome. We'll just leave with that one. All right. If you want to know more about Chloë, you can find her occasionally on Instagram at Chloë_Murdock Murdock PT. And then your website is just Chloë Murdock, right?
Chloë Murdock PT, yeah.
ChloeMurdockPT.com. Awesome. Thank you so much for not only telling me about Commando and all the things bike fit, but sharing all your knowledge on pelvic floor and biking as well. And thanks so much for being on the show.
Thanks for having me.
Did you enjoy the podcast? If so, leave us a 5-star review on iTunes and tell a friend to do the same. Are you a postpartum mom or postpartum pro wanting to know more about getting back to running after baby? Check out all my free goodies on carriepagliano.com. This podcast represents the opinions of Dr. Carrie Pagliano and her guests to the show. The content should not be taken as medical advice and is for entertainment purposes only. Always consult your healthcare professional for any medical questions.